We're going to go ahead and start. So we have a microphone, but it gets a little noisy in here. So we'll go ahead and let Elizabeth start.
Hi, you guys. Welcome to Imagine Plastic Surgery. My name's Elizabeth. I'm Dr. Hardesty's aesthetic guide. I just want to thank you all for coming. I would like to especially thank Lisa for her choreographic skills and getting all of our vendors, and thank you to all the vendors that came tonight. Thank you so much for the returning, and welcome to the new. If you've never been here tonight, I assure you we're going to have some fun. I do what's called patient counseling. So when people are pondering a decision to have for their cosmetic surgery goals, I try to provide them with some reassuring information. One of the things I like to tell them about Dr. Hardesty is that he is an Inland Empire guy. He had his training. He graduated from Loma Linda University School of Medicine, and then 9 years postgraduate training resulted in him becoming double board certified as a general surgeon and a plastic surgeon. Shortly after that, Dr. Hardesty was recruited to Loma Linda University Medical Center. During his service there, he was very busy. He became the chief of plastic surgery. He established the first accredited plastic surgery resident training program. He's actually known as the teacher of plastic surgeons. And I know that's encouraging and appealing, isn't it? Dr. Hardesty has helped train approximately 40 board certified plastic surgeons in this area, Beverly Hills, Newport Beach, La Jolla, all over Southern California. Since starting our private practice here in Riverside, his focus is on cosmetic plastic surgery. Dr. Hardesty has earned numerous awards in the field of plastic surgery, including being named top plastic surgeon of the Inland Empire for 11 consecutive years. He was elected the president of the California Society of Plastic Surgeons in 2014. Dr. Hardesty is admired and respected by his colleagues, appreciated by his patients, and beloved by his family and friends. However, his greatest joy is our happy patients and his family. So it is with my honor I present to you Dr. Robert Hardesty.
I wish my mother was here to hear that. Thank you, Elizabeth. Like with all good things, time and age comes to being. I've been happily married 38 years, and Elizabeth has been with me 34 years. So I have two wives, and they both tell me what to do. And as a good husband and as a good worker, I do what both of them say. Okay, Nancy is head of our audiovisual back there, and our clicker somehow got lost, so I'm going to have to say next slide. Next slide. Okay, hospitality. Whoa, not that fast, Nancy. Okay, the refreshments are in the back, which it looks like most of you figured out. And then the restrooms are right behind the elevators. Okay, and thanks. We'll go forward there. Okay, next slide. Okay, this is who I am. You saw that. Bye. Next slide. Okay, this is our staff. You met Elizabeth. Chelsea is our physician assistant. Lisa is our office manager. Stacy is an esthetician. Deborah is a physician assistant. Alicia is an esthetician. Tammy is an RN, nurse injector. Narcelle is our MA, and she's been with me many years too. And Teresa is an MA. And then we have from our surgical center is Jordan and Eddie as such. So anyway, we have a big family. They've been with us a long time, and they all share our values and our culture, which is taking the best care we can of our patients. Next slide. Okay, we're going to go ahead and talk about different options. Next slide. Okay, Nancy, maybe just, yeah. Okay, this is good. Perfect. Jason, in the back. Where are you, Jason? There he is. Okay, he's from Galderma, and we're going to talk a little bit about him. And what we're going to do is talk about all of these different things. Now, why? I've got some props here. If your only tool is a hammer, what do? Now, but if you have a saw, you have a wrench, you have some pliers, you have some clamps. So, if your only tool is a hammer, the whole world looks like a nail. So, you go to some people's office, all they have is a hammer. And what are you going to get? A nail. So you got to have one goal, many options. And that's what we're going to talk about tonight. Because what's good for Mrs. B may not be good for Mrs. C. Mrs. D may want something else. But if you can only offer them one thing, what are they going to get? One thing. So one goal, many options. That's the theme tonight. Let me hear it. One goal, many options. There you go. Next slide. Sculptra, collagen stimulant. It's not a filler. And we're going to be sending, anybody give us your email, we're going to give you references to everything you say. Because tonight, I guarantee, when you get done, your heads will be spinning. Because why? We have many tools. If we just had one hammer, we could get this done in 5 minutes. Okay, Sculptra, collagen stimulant. You actually have 4 injections, 6 weeks apart, and it stimulates collagen for filling. Lasts 5 to 7 years. Amazing. Look, first used for patients with AIDS, where they were emaciated, and then when they got done, they had full faces. So anyway, next slide. He also has Dysport. That is a neuromodulator. Botox is what first got popularized, and now there's 3 to 4 of these. And I just heard Allergan picked up another one. Anyway, takes the wrinkles out. How does Dysport work? How does Botox work? I'll make the analogy. If I put a locking gas cap on your car, and you drove around, you could drive around till you ran out of gas, right? But as soon as you ran out of gas with the locking gas cap, you couldn't fill it, right? You can't drive your car. That's the way both Botox and Dysport work. It latches on to the cell, the neurotransmitter, the gasoline is shut off. Therefore, the car runs out of gas, the nerves run out of neurotransmitter for about 6 to 9 months. Takes away those wrinkles. Next one. Barbara. Where's Barbara? Okay. Barbara of Allergan, okay? There she is. Now, what we want to do too, and we're going to talk about this, is I think we went past those slides very first, because in your things, there's 3 or 4 different colored tickets. You'll get it. If, for instance, if you like us on Facebook or Instagram, then you'll go ahead and fill that on out. Yeah, we somehow, I don't know how we blow, there we go. Okay, yellow. For the thing, what does that say? Place in the container after, sorry, it's going off there. Can't read it. Blue, follow us on Facebook. Anybody that follows us on Facebook or Instagram, do you know, where's Antonius? Where's Antonius? He's taking a photo. Antonius helps us with our social media. Do you know we hit 18,000 Instagram followers? Yeah. So if you follow us, there's specials on that. And tonight, if you show that, you can put it in there, and you can get one of the $10,000 gifts. Okay, blue, that's it. Green, that you want to learn there. Pink, green is a form if you want to consult with me, and then pink is with Dr. Ghosting, and Dr. Ghosting just called me. He had a family urgency and won't be here tonight. But he said if we filled out the things, he'll make a consult here in our office with you. So I apologize. He had a family emergency. He regrets it. Anyway, back to Barbara. There you go. Okay, Botox. We're going rapid speed. So if we continue tonight, we'll be done around midnight. No, just kidding. Okay. Okay, there's Barbara again. Hi, Barbara. There she is. Okay, next slide. Okay, Juvederm, hyaluronic acid. What's a hyaluronic acid? You guys all have hyaluronic acids in your body. It's the fluid in your knees, your fingers. It's what lubricates your movement. And so it's now been synthesized, non-human, non-animal, and it's injected, and that hyaluronic acid draws water in, and then that's what gives us, plumps up the lips. Next one. Volbella. Now, what is Volbella? That is a hyaluronic, but it has more cross-linking. So it's good for the cheeks and the mid-face to give you those high cheekbones. Takes away the folds. Next one. Okay, we talked about Botox. Next one. Kybella. Who wants to get rid of fat? Okay, no one's going to admit it. I want to get rid of fat. Okay, this is a way to non-surgically get rid of fat. Now, we isolate it right now to the neck, but in other areas. Each of you, when you eat something, you have an enzyme secreting right now. How many people got food tonight? You are all making Kybella in your stomach right now. Did you know that? That's what's digesting the fat and making it into sugars. So the doctors on a research took that same enzyme secreted by your liver and your gallbladder and now have synthesized it to dissolve your fat. So how does it work? You come in and we do one layer of fat. You come in a month later, we do the second layer of fat. A month later, the third layer of fat. And it goes ahead and dissolves that fat. Next one. One goal, many options. How do I hear that? One goal? Okay. Now, the aging process. This is a dead giveaway. We'll do facial rejuvenation. We'll get men and women looking good, but what gives them away? Okay, do you see those veins? Look at this. This is radius. It gives the youthful hands. It hides the veins. Okay, we can do that too. What is radius? Radius comes to us from coral. That coral is then ground up, put together, and can last 1 to 2 years. It's an injection, simply done. Chelsea did this. Next. Melissa. Where's Melissa? There's Melissa. How many people want to get rid, again, you probably won't raise your hands, but want to get fat removed, no downtime, no pain, and no money? No, sorry, no, forget that. Okay. 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 You'll have to talk to Melissa. She may give you a big discount tonight. Thanks there. Okay, next one. She comes from Cinnamon Candela. This is the Ultra Shape Power. This is a phenomenal machine. Been used worldwide. Hundreds and hundreds of thousand cases. We had Cool Sculpt, and I'm not dogging on Cool Sculpt, but we found that there was pain, numbness, longer recovery. With the Ultra Shape, how does it work? Ultrasonic waves go through your body, just like how many here had an ultrasound when you were pregnant? Okay, that's the same, but these waves are focused, and they're a different ultrasound frequency. They go through the skin invisibly, they hit the fat cells, and they dissolve them. And then the body washes them out. No downtime. The right case for the right person. One goal, many. There you go. Next one. So let's look at here. Next one. Next one. Now, not perfect. There's a little sag. The skin's a little loose, so we have a solution for that. Now, there's two types of fat. Internal fat. It's on our kidney, liver, and spleen, blows out like a balloon. Fat that we can grab. That's the fat that we can take care of. The internal fat can't do, because we don't want to go there internally. But the external fat, These things are non-invasive, no downtime, one goal, many options. Next. VeloShape. And the important is 3. This is the 3rd generation. This is radio frequency, another modality. This goes into the skin and tightens the skin. So all our patients that have liposuction get VeloShape. Why? If we just do liposuction, we're deflating the balloon. What do you think happens to the skin? It sags. And so all our patients after liposuction get VeloShape. And we'll show you some pictures. Next one. So here it is. You can see the treated and the untreated area. And it's important, VeloShape 3. Next. VeloShape 3. Good for cellulite. Stacy's our expert at this. She'll tell you whether you're a good candidate or not. Next. CO2 ablative. Well, what is that? Okay, now we're moving to lasers. We've talked about radio frequency. We've talked about ultrasound. We've talked about fillers, different types. Now we're going to talk about lasers. And everybody loves to say, a laser surgery. It sounds mysterious. Again, if your only laser is a hammer, the whole world looks like a nail. There are about 20 different lasers in use today. So if your doctor says, I have a laser, that's great. But you have to have the right laser. In other words, if I'm going to try to put a wrench on a nut, you need to have adjustability so you can put the right wrench on the right nut. Some lasers work on color. Some do not. And we'll talk about it. So this is CO2. And then we call it CO2 core. So this is ablative. Next. So this is really good for post-acne. I don't know if you can see that there, but that's pre and post-acne. What it does is it very, very specific. It goes through and evaporates the outer layer of the skin. And what it does is then stimulate collagen. So it resurfaces. Great for the little smoker lines, frown lines, etc. Next. Scars. We use it on scars. Next. Fractionated. What is fractionated? Okay. Ablative, think of ablative if you have a paint roller and you paint with a roller. You get everything, right? Now think of a ping pong paddle. A ping pong paddle has little indentations and little valleys. The fractionated works just like on the ping pong paddle. It goes through and leaves normal tissue between. And so now it heals faster. And with the core, and we have it fusion, you can go deep down and almost get the same result of the ablative, the roller, with less downtime. Next. Another one, pre and post, a little hard to see with the lights and stuff like that, but the fine lines are gone there. Next. Nancy, next. Okay, and you can't, it's hard to see on this thing, but the lines, especially around here and here. When we do a facelift, think of that as carpet cutter. If your carpet's loose, and you need to go ahead and make the carpet cutter, you bring it up and cut it. But if you want to bring the luster back to the skin, or you want to bring the luster back to the carpet, you get the carpet cleaner. The laser is the carpet cleaner. Okay?